In the middle of Burundi's beautiful hills, the Musema Hospital is a sign of hope and health.
There's a big need for the population to have a hospital in this place.
Shortly after the civil war, and basically the whole hospital and the health centers we were working here in the region, they were in ruins. They started in maternity, which is a small building with 15 beds, slowly renovating the rest of the hospital, increasing the capacity till what we have now is a little more than 100 beds.
All these people are sitting here waiting for a consultation, and the queuing is the same every day. They start early morning at 7 o'clock. People come from far about, maybe after an hour, 3 hours walk, and they sit here and wait. And it's nurses that are taking care of all the patients, and once there's major problems or things they don't know how to handle, they do the transfer to the hospital for some doctors.
The Musema Hospital is a small oasis in a big desert of inadequate health care.
For Western standards, it is a very slow process. But considering that the country has been in a war for 10 years or more, that everything was in ruins, not only this hospital, but the whole government structure, I think we progressed pretty fast. 1.5 years after starting, we now have a hospital which is doing basic health care for Burundian standards on a high level for a rural hospital. We have more than 100 beds. We highly reduced mortality and morbidity of malaria in the region, and we are providing safe deliveries for more than 200 women per month, and we are seeing specialized patients, or we are doing specialized care like HIV and TB treatment, and I think for Burundian standards this is a high achievement in such a short time.
These women sitting here are waiting for the prenatal care. Burundi has built up a very nice system of prenatal care. The president pronounced in the spring of 2006 that it was the government's intention to give free prenatal care to all women in Burundi. The population has been doubled since the early 70s, so they get many children. Most of them has lost 1 or 2, either during pregnancy, during delivery, or right after they have the babies within the first 2 years.
This hospital is very good at receiving patients, receiving poor patients. MSF is here to improve access to healthcare. We are not a high quality hospital which does radiology, etc. But in this region, in this country, the big killers are malaria, mothers dying, the death of newborn children. That are our target focuses, and that's what we're covering. In the hospital and the health center together, we're seeing monthly 15,000 patients.
This woman is having a complicated birth that requires a cesarean section. Without hospital treatment, both mother and child would probably have died. Baptists and the Musema Hospital have a long history. Since the 40s, the Danish Baptist Union has sent missionaries, doctors, and nurses to the Musema area. In the 1960s, the hospital was handed over to the Burundian Baptist Union, UEBB. Since 1990, it has been managed by the Burundian Ministry of Health, in long periods without any activity. In 2004, it was renovated by the World Bank, and since 2005, it has been run by MSF, Doctors Without Borders.
So, here we have the maternity ward and the delivery ward gathered in one building. And we have 2 delivery rooms, and then we have rooms ahead where the mothers are resting after they have the babies.
The Baptist Union of Burundi, they have in their objectives also to take part in healthcare in the society. So they are used to work in that kind of areas. They are used to work with health centers around in Burundi, and they are up to the end of the 80s, 1980s, they are used to work with this hospital here.
You can see just right behind the screen right there, this is where the women deliver their babies, and the office is in the same room because there's no more room than this.
The Musema Hospital is one of only 2 hospitals in the Kayanza province, which has a population of 560,000 people.
The local population around the hospital and in the nearby, they are very poor. They don't trust the state if they are going to take over the hospital. So they are really standing around us and asking for support from some private donors.
This is a special nice story I want to tell you about a mother who came to the hospital because she recognized there would be some kind of complications, and we found out that there was twins and she was premature, and the babies were situated in the way that we have to do the cesarean. And here are the results. 2 little boys who were just 1 kilo 600 and 1 kilo 800, and now they're eating well, breastfeeding well, the mother is well.
This little girl fell into a fire and got severely burned in the head. She has now lived at the hospital for 10 months to receive life-saving treatment. The Musema Hospital has reached a high standard for a rural hospital. But even though it is well run, there is room for improvement.
People here are not dying because they lack radiology, they lack ophthalmology. People here are dying because they lack basic nursing care. A hospital can have all the equipment in the world, but if the nurses are not well trained, if the nurses are not motivated, if you don't pay them a decent salary, they will not be able to do the work. The training for nurses in Burundi is very limited. They have, depending on the level, they have 7 months training or 3 times 7 months training.
And that means there is a big challenge ahead, as MSF will soon leave.
MSF is an emergency organization, so we're not really doing developmental work. For MSF, the emergency phase is more or less over.
MSF leaving Musema could have a devastating effect on healthcare in the Musema region.
Our concerns is that the quality of care drops. That's not only our concern, that's a shared concern with the Ministry of Health. So now we are, with the Ministry of Health, seeing how they can run the hospital maybe with another partner.
And the concerns are shared by the local staff.
When MSF will leave, I think this hospital will have many problems.
For the people, it really is a big problem when MSF leaves. I am very worried for the people in Musema. People know that this is a well-functioning hospital, and I am afraid there will be no surgeon to operate, and that means a lot will die. It is also a problem if we don't get any medicine to help cure the most common disease.
This is a local ambulance. When people out in the little villages are sick, they gather the neighbors or relatives, and 4 men will carry the person to the hospital. And sometimes they walk for several hours, so they even bring 2 more men, as we call spare tires, because then they shift to carry every once in a while, because it's a heavy duty to carry a sick person all the way to a hospital, maybe for many hours. So this is a local ambulance, you could call it.
One of the problems in Burundi is that there is a lack of doctors and nurses in the country. And due to UEBB's long healthcare commitment, the state has asked the Burundi Baptist Union to help run the hospital in the future.